We're going to talk about radiation safety measures here. So we do have a dosimetry badge. This is how we measure our radiation. It's a filled badge that's wrapped in a light-proof envelope. It should always be worn while taking radiographs on the outside collar of the lead apron. The maximum permissible dose is 5,000 millirem. We do calculate this by sending it to a company called Vet1, which reads the amount of radiation. I have a chart here, and on this chart it does have the employee's name, and then it breaks it down into the current dose for the most recent wear period, and then it has a dose per year as well as a lifetime dose. So looking at one of our doctors here, she had none in the most recent wear period, she's had none this past year, and 11 millirems for the lifetime dose. Our PPE that I have over here, I have lead apron, I have a thyroid collar, as well as gloves. In terms of inspecting it, we do a visual inspection every time prior to wearing to look for any visible cracks. And then every 12 months, we do take a radiograph of it at a 5 MAS and a 80 kVp. I'll put on my PPE here, starting with my lead apron. My thyroid collar. At this point, I'll take my dosimetry badge and clip it onto the outside collar, outside of my thyroid collar, and then my lead gloves. We do not let any body part underneath the primary beam. Even with a full lead glove, only 25% of that primary beam will be decreased. We do keep everyone, any non-essential personnel are not in the room due to, we want to keep it as low as reasonably achievable in terms of radiation. We do always try and take the first x-ray, we try and make that the perfect first shot, because again, we want as low as reasonably achievable dose of radiation for everyone. We do not allow any pregnant or people under the age of 18 in this room. The reason for that is the maximum permissible dose for those people is so low that it doesn't make sense for them to even be in the room. And radiation does kill and damage cells, which we definitely don't want with pregnant people or people under the age of 18. So I'm going to take a VD thorax on my patient here. I will use the caliper and measure the thickest part of his thorax. I do get a measurement of 16. So I'm going to adjust my radiograph machine to the thorax at a thickness of 16 centimeters. I did put my cassette in the trough with my lead marker. I will do it on the right side of his thorax. I will place this into the machine. Close it up there. In terms of positioning, I'm going to center right over the midline at the caudal border of his scapula. In terms of collimation, I will collimate to the side of his body wall, keeping the V-trough in there. My cranial border will be at his thoracic inlet, and the caudal border will be at the first lumbar vertebrae. So now that everything is all set, I will flip my patient over here. Make sure he's nice and straight. Hit the lights, turn this on. Like I said before, finding the first lumbar vertebrae, collimating inwards. That feels about right to me. I'll make sure my patient is nice and straight. Put on my lead gloves. My patient is in the V-trough, which is one of my acceptable restraint techniques. And then I'll take his limbs and extend as far cranial as I can and expose the image. Let my patient sit up here. bring it over to the machine that will read the rest. Alright, so we're going to position Zach here for a cranial caudal radius and ulna x-ray. So what we're going to do, the patient's going to sit and lie down. Thank you for being such a good boy. I have my help back there who's going to, back down. Yeah. He's going to hold the back end as well as move his head laterally away from the affected limb when we need him to. So what we're going to do for positioning, like I said, ventral recumbency, forelimbs are going to extend cranially, and we're going to move his head in the lateral position away from the affected limb. We're going to measure the thickest part of or the midshaft of the radius and ulna. Then we're going to center over the midshaft of the radius and ulna as well. So I'll grab my caliper here. There you go. Like I said, I will measure over the midshaft. This, please. I get a measurement of 5 centimeters. So I'll set my machine to an extremity at 5. It likes a tabletop of 42, which is already there. I'm using my smallest cassette possible. So Zach's going to sit. Sit. Down. Hey, down. I know. Down. So now that I measured and set my machine properly, what I'm going to do is kill the lights here. Stay there. Okay. So my patient is all set here. Jamie's going to move his head laterally away from the affected limb. What I'm going to do here, make sure everything is perfectly straight. I'm going to collimate inward as much as possible, as well as both front and behind. I'm going to take a piece of tape and tape over the top of his paw.
And then I'll place my right lead marker right here.
All right, so my position is my patient is positioned perfectly. His paw is nice and straight. We've collimated inward. I have all my PPE on. I'm going to expose the image. All right, so I'm going to utilize my radiograph equipment to properly radiograph a live animal on my digital machine. So I take a lateral thorax of my patient here. So I'm going to use my caliper and measure the thickest part of his thorax. Right about there. I do get a measurement of 22. So I'll set my machine to thorax. And set it to 22 centimeters. So once it's in the bucky, I'll take my cassette, place it in the machine, close it up. I will also take place my marker in the machine. The next thing we'll do is position my patient. So I'll shut the lights off and place my dog in right lateral. Right lateral, 1, 2, 3. Good boy, you stay. No, you stay.
Stay.
In terms of collimation, what I'll do is I'll put it at the thoracic inlet, is the cranial border, all the way down to the first lumbar vertebrae. And we're going to extend his forelimbs cranially. And collimation will make sure his entire chest is in the x-ray. And now that I have everything positioned properly and collimated, I will expose the image. Good job, Zach. So I'm going to appropriately label, file, and store some images here. So for our digital system, when we turn it on, we get a registration page like this. Our standard operating procedure is we put the patient's ID number into this field, which is the accession number. We then put our patient's first name in here and their last name in this patient ID. We move forward to date of birth. Sex is a male, and who our technologist is, which today it's me. And then we hit next, and we do choose from all of our different views which view we will be taking. To get out of this, to find a radiograph in the file, I do click on the All tab and type in the patient's name and hit enter. I find the date of the study that I'm looking for with the correct patient, double click on it, and my radiographs pull up here. So I'm going to complete a radiograph log for a non-digital system, even though we do use the digital system here. So our standard operating procedures, we do have this chart here. I'll write today's date, our patient information, the breed of the animal, the area of the body, which this one is a stifle, measurement, which I pull off of my machine here after we measure the patient, which is 7. My KVP up here goes in this one. I pulled my MA and my MAS off of here, and my time, and any additional comments I may have about the radiograph. And then I'll go to our digital system where we keep all of our patient files and input this in. Alright, so now that I have my radiograph log, I'm going to enter it into our medical record here. So I'm going to pull up the patient. I will find the line item that says radiograph and click on the More Stuff tab, which is where you input it. From there, I will put in today's date, their ID number. We took tabletop radiographs, the view. I'll put in the thickness. I'll put in my KVP, as well as my MAS, my MA, and the time, the doctor and technician that took the radiograph, and whether our patients were awake, muzzled, sedated, or anesthetized, and in this case, the patient was anesthetized. I hit OK, and that will save everything for me. The other thing I will do here is I will show how we file alternative imaging in our account. So our standard operating procedure, we're going to add a line item into the account, and that line item, the code is HX, which is going to give us a bright green line that I'll change to whatever the title of the alternative imaging, which in this case it is ultrasound. So when I put that in there, it's going to put a nice green line right across his account with the title ultrasound. From there, I click on the Attachments tab and attach the ultrasound report, which does come from the internist, and I attach it right there. And that's it. It's in our medical record. Alright, so we're going to do an esophagography on my patient Zach here. So my machine is already preset, measured, and everything. What we're going to do is we're going to place him in lateral recumbency and make sure it's collimated at the base of his skull down to T12. What we're going to do is give him a little bit of the barium-soaked food. The moment he swallows it, we will expose the image. So, let's get back into it. Move the table back towards you. Oh, wait. Give me this. Let him. Kev. What came from over now? You grab those backpacks and roll. 2, 3. Stay. One, stay.
Hey.
Going to use a sandbag here, one of my other appropriate restraint techniques, and place it right over the side of his thorax. Stay. Hit the lights. And we're going to slide Zach back towards you. And like I said before, towards me just a little bit, I'm going to collimate down because all I need is the base of his skull and his neck all the way down to T12. So that looks good there. So I'm going to give Zach a little bit of this barium-soaked food. And the moment he swallows, I'll expose the image. That's it. Alright, so we're going to do a VD pelvis here. I measured the thickest part of her pelvis, which was at 10. So I'm just going to set it here to about 10.
We use chemical restraint for this patient, which is one of our restraint techniques.
I have her centered over the midline of the ischial tuberosities. So what we're going to do, Jamie up front is going to extend her forelimbs. I'm going to extend the hind limbs and rotate her stifles in medially. Get her as straight as she possibly can. Then I'm going to expose the image.